So my name's Sunit. I'm a clinical pharmacist. So surgery में काम करो. So pharmacy में काम नहीं कर रहा. So I work in a doctor's surgery. I look after blood pressure, diabetes, and I do a lot of medication work. So Rona asked me today to come and speak to you just about medication and the barriers you guys have and the problems you think with medication. Because I know people, you almost maybe take medication, but do you know why you're taking medication, or what's the reason you're on medication? Do you have your annual checks for medication? Do you know the side effects of your medication, when not to take your medication, when to take your medication? I just want to ask you guys, what's your thoughts about medication? Are you all, any of you on medication at the moment? No, you're healthy. You are.
I'm not happy to. Okay. Maybe I might in future because I recently checked my health and I'm in the border of diabetes.
Diabetes, okay.
So on diet, and they put me on not diet, but
observation, okay. So you have to diet control. Same thing.
I don't want you to take it. I don't know what to do. I have to ask you.
Okay, that's fine. I take
omeprazole.
Okay, that's okay.
Okay.
Take Ramipril. Okay, so
recently they did a bone scan.
Okay.
And they said you got an osteoporosis. They started prescribing me
alendronic acid. Alendronic acid. Okay. Good.
So
Just started last week. Okay, and how do you find your medication taking it?
I'm fine.
Any problems? Do you remember? Do you forget, or do you remember? Always take your medication. Good.
Proper timing.
Excellent. Okay, and do you know what's available in a doctor's surgery now for? Besides seeing a doctor, do you know what else you can do? Say if you want to see someone about your medication, or you want to talk to somebody about it, who would you contact? Just to see a doctor? Is that what you do? GP. So you now, what you realise in practice now is pharmacists work there, pharmacy technicians work there. So sometimes it might be easier for you to book with a pharmacist instead of booking with a doctor, because you'll get more knowledge from your medication rather than seeing the GP. GP are there, brilliant, but they're very quick. They're more... so very particular about medication. So
sometimes you won't get GP either.
This is the nurses. So you have to now realize in doctor surgery that you have to maybe use different people to see different things. So now they have physiotherapists working in there. They have something called physician's associates, which can see you for minor problems like infections or pain. They have, so they've all got these new people working in there. They've got mental health practitioners. So if anyone you know is struggling with mental health, they have special people for mental health. They have ACPs, which are care practitioners, which are like GPs, so they can see complex problems. So sometimes think about it. Not always go to your doctor if you feel there's other people that can help. Most surgeries, so all the surgeries I work in, all the surgeries I look after. So
do we have to make appointment?
Same. So when you ring up reception and say, I want to review my, so say you have a medication review, which you should have done every 6 to 12 months. So make sure you keep on top of this. I know some of you are not on medication, but if you are on it, you should have it checked every 6 months. And for you guys, for your non-diabetes, which you're on the borderline, you should make sure you have a blood test every 12 months. So you have to, the problem is you have to request this now. The chief practices won't ask you because they're so busy that they've decided that they leave the responsibility for the patients to try and do this. So in your case, where you're both on the borderline at the moment, you should make sure that in 12 months or even 6 months that you have ask for a blood test again to check your levels. So it's very important. Every 6 months you should get a blood pressure check done. Either do it at home and give your readings in, or go into the doctors. Again, you can see a HCA or a nurse can do your blood pressure. You don't need to see a GP. Some pharmacy, you can even walk into your pharmacy now and they'll do your blood pressure for you. So things like this are very important to keep an eye on, especially as you get older, because diabetes, blood pressure, they're all linked together. Cholesterol, there's a triangle of 3 they're called. So if one is a problem, then there's a chance you have the other 2 problems as well. So for your case, you take Ramipril. I take it for blood pressure, is that right? Yes. Okay, so do you keep an eye on your blood pressure?
Yes.
Yep. Do you know your numbers, what you should be?
Normally 125, 80.
Okay, so you know it should be under a certain barrier. Okay, that's fine. And do you guys check your blood pressure? So it depends on your age for blood pressure. So if you're under the age of 55, then you go on something called Ramipril. And if you're over the age of 55, you'd go on something called amlodipine. So it depends on your age, what you're going to take. But normally, all blood pressure medication works very well, as long as you... numbers. So under the age of 80, you should be looking around 140 over 80. That's your number. Anyone over the age of 80 should be 150 over 90. But if you're a diabetic, then you need to have your numbers at about 130 over 80. So where Auntie is saying about 125, 130, that's really good blood pressure to keep it at.
Yeah, I just did it last week.
Okay.
It was 128.
Excellent. Yeah, nearly athlete, that's 21-year-old blood pressure that is. So that's thorough blood pressure, very good blood pressure that is. So you should try and check it.
First time because I went to my mother-in-law and just saw that because I had my sister-in-law kept measuring the blood
Pressure.
to my mother-in-law.
It's very important. You should keep an eye on your blood pressure because blood pressure is silent. You won't feel, if you've got high blood pressure, it's very rare that you'll feel any problems. You might get a headache or your eyes may go a bit funny. Yeah. But generally you wouldn't know if you...
You wouldn't know.
Yeah.
Because diabetic, at least you know the
Yeah, symptoms. Yeah, you feel thirsty and urination. But with blood pressure, if it's high, it's very chances you won't know until you have it checked or picked up. So I would recommend, if you can, maybe once every 2-3 months, you check your blood pressure. And if you have a high reading, then you should speak to your, again, you can go into your surgery and speak to a pharmacist and they'll ask you to do some at home and then they'll check your levels again. Weekly. Yeah, and just check it weekly. So do keep an eye on your blood pressure because you don't know. And the problem with blood pressure is it can cause things like strokes and heart attacks in the long run if you don't have it under control. So it's very important. And especially unfortunately, if you do become diabetic, then your blood pressure and cholesterol is the two things you have to keep very tightly controlled because them three will go together. So that's a little bit about blood pressure, a little bit about diabetes, but obviously medication is the main thing we're here for. And right now you're lucky you don't take any medication, which is good. Yeah.
You want to get medicine
For diabetes.
you have to control, you have to control whatever you want.
Okay.
Tea and everything.
So tell me sugar control. What's your ideas?
Sugar,
Huh?
no sugar, I want to take it sometimes.
Okay.
But for they said no rice, no chapati.
Yep.
But it is balance.
Balance. Okay. Kau biju kau tu?
No sweet. When it's great.
Grapes. So mandre jawane siro lewano prasad betul bus.
Mainly medicine.
Medicine. When I do eat medicine every day, I soak it overnight, I think, but I can't.
Fenugreek said, yep. Ha.
And I had like glucose when I had my last child,
Okay. Ha.
so that's why I didn't sugar as well. And then they were like every 6 months they checking until now. Now they said, okay, you are in the
Borderline.
borderline, yeah. So they might say, okay, we'll see. Otherwise, they might.
So patch blood test also determine. So doma surgery mapuchano, they do a diabetic program. If you're on the borderline, they can refer you to a program that they do, NHS program. It's an 8-week course. It's very good. They teach you about how to make sure that you don't go into diabetic level and how to eat carefully and what to do. So you're doing the right things, low sugar. Now, potatoes, rice, pasta, you have to be very careful how much you eat. People think diabetes is just sugar. It's not. It's the carbohydrate.
Yeah, it's the more sugar, you get sugar and fruit, then...
Yeah, fruit, chapati, yeah. And then you got to, so you can eat.
Fruit is good.
Good.
Rice is chapati.
Yeah, natural sugar in there. So some people think fruit's good. Moderation. So you can eat rice, potato, but the problem we have is we don't burn it off. So you have to look at minimum, they say, is 2.5 hours a week of exercise. Now, I'm not saying gym or badu, but walking, wherever you can do, if you can do swimming, which is very good. If you can do fast-paced exercise, 20 minutes a day of fast-paced is very good. So get your heartbeat really fast. So I tell patients, when I talk to patients, what can you do? I say, just walk up and down the stairs 20 times, as quick as you can. That's enough, yeah, because some people can't go outside and don't want to go gym, but you can do things at the home. Up and down the stairs 20 times is very good exercise. You can do that. You can, as I said, do fast walking. You can do chair exercises. So I know Auntie was saying very popular, yeah. So keep going to the chair exercise. There is obviously other classes like Bollywood dancing that's come out, Zumba. There's these little classes. I know people say, we don't want to do it, but you don't know until you try. I think Rana will probably give you some more information about that after.
Online also, there are so many things.
Yeah, so online classes. So it's very important to exercise. Thing is, you could be eating well. If you're not exercising, then you're going to have trouble somewhere along the line. So I know in our diet, our Indian diet is tough because we can't control. Yeah, we can't control. And a lot of people have bath every day with their shak. So even little things like that, maybe making rice only once or twice a week instead of every day. Now, if you don't, are you vegetarian, brother? Or vegetarian, I was going to say. So yeah, it's a green vegetarian. It's good. Spinach, methi, pinda. That's all the very good stuff to eat. So you should try and have that as much as you can. Now, I'm not saying don't treat yourself. Samosa about the kawano. Enjoy yourself, but be careful. Now, what I do at home, or what I've told all the patients is try using air fryers instead of frying. Don't fry it. Or grilling your food if you have an oven, like potato, the roast potato, but instead of chips. That's very important. Little things will make a big difference. Now,
nowadays our kids is very conscious of that food as well. They say, we don't want to be studying.
That's how you have to. It's good, yeah. And when you're over 40 now, when you get over the age of 40, your doctor, you should have an NHS health check. They should have called you for a health check. So make sure you all go to your health check, or if you don't hear from them, ring them and say, can I have my health check? Because they do all your blood tests, they do urine check, they do some ECGs, and they can keep an eye on your cholesterol, because cholesterol you will never know until you've had a blood test, or unfortunately if you have a heart attack or something, then you may realize that you had high cholesterol. So you need to make sure that after the age of 40 you have these blood tests done. Now, some practices do them every year, so you have to be a bit, not forceful, but you have to ask them. If you don't ask them, you won't get it, because they won't ask you to come in. But after 40, this health check is a new big thing. That's, Auntie said, is very important that you get done. So if you've not had it done yet, you should have had it get yourself booked in. And also, make sure you have these blood tests once a year or every 2 years, whatever it is. And if you're on certain medication like Aunties or Ramipril, you should have a blood test every 12 months to check your kidneys, because blood pressure, diabetes is all linked to your kidneys as well. It's not just your heart, it's your kidneys that can get affected, your eyes.
I did a kidney test twice at home. The kid came to my home. Because, a few years back,
All right, Shanti, what's up?
she died because of kidney problems. And I used to tell them surgery as well when they asked, my mother, then they start sending me every year.
Good, yeah. So Jawano, so if you have these they send you tests every year. So you have a urine test. Yeah, good.
From the
apps, yeah. So it's very important. So even when you have a blood test, they'll check your kidney to make sure everything's going okay. And then obviously you can, even besides the doctors, you should get your eyes checked once a year. I know people don't forget about this, but your eye test is very important. Especially if you, screening, eye screening. So yeah, that's important. If you're diabetic, they'll call you every year for eye screening.
That's why they find out you are on the
borderline. Yes. So we have to be very careful, because if you go above, then thinking, all right, Shanti, good. Après diabetes and blood pressure no વાત કરે છે.
I got diabetes.
Okay, so તમને ખબર છે diabetes માટે શું કરવાનું? તમે yearly eyes check કરો, feed કરો, તમે દવા blood test કરો, તમે દવા લો છો diabetes માટે? Metformin. તમે લાગે all right metformin? કેટલી લો દિવસમાં?
2 morning time, 2 night time.
All right છે?
Up and down.
Up and down. તમારી diabetic level અત્યારે level નથી આવ્યો અત્યારે? શું થાય છે?
Doctor બીજી change tablet.
શું આપ્યું? ખબર છે કઈ આપી? Small one, okay. Glycoside છે or Emper? Okay. The blood pressure છે? દવા લઉં છો? કઈ લઉં છો? Amlodipine. ને blood pressure અત્યારે કેમ છે? Up and down. તમે check કરો ઘરે?
Check કરું.
Every day check કરો? ને શું લાગે છે અત્યારે? આજે check કર્યું છે? ગઈકાલે? હા બસ ગઈકાલે? ગઈકાલે check કર્યા હતા? શું હતું numbers?
Between up 100.
Okay. So થોડુંક high છે તેને અત્યારે? Okay. ને તમે diet ને exercise કઈ કરો છો? કઈ નથી કરતો. કેમ નથી કરતા? તમે શું stop કરો છો? તમને exercise or dieting? રોટલી ગમે? ચપાટી રોટલી ગમે ને? સમોસા ગમે? હજી કામ કરે છો? હજી કામ કરે? Okay. So તો ક્યાં કામ કરો છો? Hospital. Okay, સારો. Cleaning. So you have to be થોડી careful. આંટી તમારે કરવાનું છે કે તમારે blood pressure high છે ને પણ diabetes છે. cholesterol છે? So દવા લેવો છો? Atorvastatin? Okay. So તમે high category માં છો અત્યારે. So have to be careful slowly. So you have to slowly walking jaw cho? Or sometimes. So every day was half an hour. Chalwa jawano. Very important mare. Ne tame vegetarian cho? So tame methi, bhaji, pinda bado khao cho? Good. Sweets? Sweet khao cho? No sweet. But stop kare che. Okay. Karwano khawano? Bhajia ne samosa ne bado? Bas to mane khaba che ave. Bas to. So thoro cut back karwano. Thoro echo bare time a week ma. Because very important.
During COVID time,
Yeah.
it was so bad.
Yeah.
I had to have an endoscopy.
Okay.
They didn't do till 2022.
Right, okay.
And they found out after endoscopy that I got side effect of cirrhosis and esophageal varices.
Yep.
But then I saw the consultant, liver consultant, Dr. Lee,
Yeah.
Leicester Royal, and he said, you don't need any treatment, but we'll keep an eye on you. So they keep doing tests. But since then, I came to know I stopped most of the fried food. I hardly...
Bas, yeah. So
That is nothing.
fried food is very...
I used to...
Bo bhave, mane pan bhave, but awe to control. Yeah. So awe air fryer karwano, air fryer bo saro ave. Frying sathe. So air fryer is good. Oven. Now obviously tamare ladies as you get older, osteoporosis, bo mota ave.
Also, they did the bones.
Yeah.
That's what they said.
So tamara bones ave.
But I'm very active. I
Yeah.
don't know if they...
So suthayo obviously females ma estrogen hormone ave ne tame menopause ma jao ne estrogen cutting chai. So osteoporosis bo moto che, especially Asian women ma heart attacks. So I tell everybody to take vitamin D once a day, 1,000 units. You can buy it £1 for a 90 capsule without prescription. Pharmacy chemist ma jao vitamin D. D. 1,000 units ave. Then it's ne. Yeah, boss ne ek divas man lejo. It will do so much. Sun namare ha. If tame meat no cow, so no fish no cow. So if tame yeah, so vitamin D kya ati ave. Cheese cow. Toric cheese vitamin D ave, but not anti cheese for ni cow. So vitamin D tablets more important ave. But that you should live on the ekaj divas man.
Yogurt. Nowadays you can't eat yogurt.
Yeah. So pharmacy ma leo jajo ne bo important vitamin D ave. Tamra mate bo help kar All bar. Bada maris. Oh yeah, pharmacy mari pound ma 90 tablets. Bada mari, yeah. Vitamin D. Yeah. Bo important for especially for upper Asian women it's
They don't check vitamin D
No.
even here
No.
because it's an expensive.
expensive blood test, and plus they don't do your bone scan here maybe occasionally if you have a fracture.
Luckily, he did.
Yeah, you're very lucky. If you have a fracture or something, then they may do it, but otherwise they won't do a bone scan. And they won't cover, you won't know if you've got osteoporosis until you have a fracture or you fracture your hip or your arm. Then it's a problem. Once you have a fracture,
When because I'm in border, they check my foot and everything.
Yeah, foot,
They
yep.
said you have to be careful, make sure you don't hurt you.
yeah, so because when you have diabetes, your feet feeling goes, your nerve feeling dies. So if you hurt your feet, you won't know. So you have to be very careful when you when you cut your nails,
It's burning.
burning hair. So you have because the diabetes level at there high.
Like the heel is sometimes killing.
Yeah, or tingling. You get tingling feeling.
No, killing is very painful.
Very painful. That's probably something else called flantifisculitis is probably called. So you probably need to see that that's inflammation of the heel. So you need some special tablets for that one. So again, you can get booked in, but that's not diabetes. What happens in your feet is you stop feeling it after. It starts burning.
Sometimes you can't put the feet down.
Yeah, that's plantar That's probably plantar you've got there. It's like a swelling of your heel. Yeah, tennis ball or water bottle roll around. But yeah, with the diabetes, your eyes and feet are the first that goes, and then your kidney goes. 3 things that get hurt very badly in diabetes. So it's very important that you get your diabetes level down as quick as you can and keep it at a good steady level. So no levani exercise karano, dieting thoro karano. That's it. If samosa ne bhajia, no.
Moti chokli bad.
Cross, bus, that's it. No, but that, yeah. So it's important that you do this. And as I said, doctor surgery, my pharmacist chair, physio's chair, but that chair, booking with them, and even your chemist, Javano, the pharmacist at the Wat Karani, medication review Karani. So you have a review every year, is it? Every year. So make sure you go for the medication review and
my appointments reviews all the time by texting.
text RHI.
Yeah, that's fine.
Yeah, so make sure you go and question which one. If you're not sure about anything, do ask them because they might say.
I asked today about him.
Yeah.
I didn't go to the doctor for that because
Yeah.
I can't make an appointment.
Yeah.
Very busy.
Yeah. So when you
So if I go to the chemist, do they do that?
no, so you'll have to get a prescription for the doctors, but you don't have to see a doctor. You can see a physician's associate. You can see a practitioner, which is like a doctor. They can prescribe. I can prescribe. I'm a pharmacist. I can write dawa. Pharmacists can write dawa.
I have to go to see the doctor.
Yeah. Or you can go in there. They might give you something else. You can take like ibuprofen, which you can buy. Same kind of thing. But as I said, Auntie, you can do the roll exercise. That will help with the pain in the heel. It's very good to help. So yeah, you have to do that. And as I said, vitamin D is very important. Make sure that's one thing. If I leave today, is start your vitamin D, because if you don't have enough vitamin D because you're not eating meat, sunshine, and obviously you don't have oily foods, oily fatty fish, which is very good, but you're vegetarian, so it won't work for you. So take the vitamin D. Do you have any questions about anything you're not sure about? Dominic, put
One finger only,
Okay.
bigger one. It's so painful. I don't know why. And then I went to the pharmacy boots.
here.
And I get some
Okay, and Farrell. So it's just pain all the time. Koi biju nathi, pain jave.
I'm hard. They change skin cover it with the air. To for it one can if the target in them want that not that you don't cap it now for anything.
So a hard skin thai gyu che badu.
Hard skin to like wrap it up the neck and tori.
Ha. Yeah, it might be callous. So thick callous skin. So you can get a callous knife, rub it off, and then put rub. Ha. Machine prave or stone panave that you can rub the callus off. So it might be hard skin that suche. Soji guche? Okay, nothing garam ka nothing ka. Okay. So it sounds like hard callous skin che. So tame pharmacy mein jao jo ne callous stone le jo rub kar jo. Ha. And or fair like guche? Oh, vegetable che. Okay. There we aji lagse. So try kare. Okay, biju Sarun. Birds. Yeah, of course, Auntie.
When I sit down for a little bit longer on that sofa or something, the bottom bits in here is get pain, it's too much. I don't know why. It's not a sciatic, right?
No, it might be just where you're sitting. Do you sit with a cushion?
No, on the sofa.
Yeah, with cushion level, best one cushion ma. Because it could be that. And then what I'd say is
That happened last few months,
Last few
3 months.
3 months.
Yeah.
Then put you stand.
To stand up.
Then put your right hase.
Yeah, but you're right here,
So it could be that best one is on a nerve. Yeah, you're sitting on your nerve, which could be causing it.
I know sciatica is not is a back pain.
No, sciatica in your legs, in your legs.
They're all fine. So rolling out. Both of is killing sometimes. Then I sit for long.
Ha.
And then I have to stand up and walk around. And
So yeah, so I think you have to walk around, and if it carries on, then what you need to probably do is you probably might want to see a physio. Now again, you can do it. There's physios in the practice that you can have a look at. Walking, yeah. If walking helps, then, yeah. Stretching is important, yes. Because it could be that your muscles are becoming weak because you're not using the muscles as much, so they become weak, and when they become weak, they start to hurt. So as Auntie said, you should be stretch out. So most people wake up and they do 10 minutes of stretching, which is very good. Things like yoga, a lot of people do yoga now. So yeah, yoga is very good. If you can get into one thing, yoga, I would say. Yeah, it's brilliant yoga. Everyone I know speaking to now started doing yoga once a week or twice a week. They go and do yoga for the stretching. So I think that's very good that you should do. But I think generally, you just make sure vitamin D is the main thing. Try and do at least 2 hours a week of exercise if you can. Obviously, none of you are overweight, but just keep an eye on your weight. Don't make sure it doesn't go up too much and it doesn't drop too much.
lots of weight.
Okay.
But, last year, from last year, I lost lot of weight.
That's good.
That's why I went to the doctor. The doctor said, "Oh, you lost lots of weight. Maybe you are diabetic."
So that means your diabetic level has gone better control now because of weight loss, right? Is the diabetic level nichu avigi?
Yeah, right. Yes.
Got
Still, I have to. They give me the diet chart,
Okay, ha.
so I have to follow that. I have to follow that as well.
Okay,
And I try.
good. You have to follow it, yeah. And then, as I said, you can have treats, don't get me wrong.
Only eat chapati once a time, one or two chapati per day. But if I eat chapati, I don't eat rice. If I eat rice, I don't.
So you do one of the, and try and eat, and try not to eat anything after 6, 7 o'clock. If you can. I know it's hard. If you try and have your food and then finish at 6, 7 o'clock, that's because at night time, if you're eating late, that's a big problem as well, because you're not burning anything off and you're going to sleep and it's just storing into your body.
But if we eat late, I can go for a
Walk,
but
yeah.
winter, I can't.
Yeah, so it's very important.
Plain flour, mendo.
No, so we don't eat mendo. Even I just do pizza at home.
Yeah,
So I use chapati flour. I don't use mendo.
men flour. Yeah, no, it's fine.
Yeah, for children, I have to make something.
Something
like
nice, pizza, yeah, and then have it.
that. So I don't like them to eat mendo as well.
Yeah.
They don't eat. They eat bread, but always brown bread.
Brown bread, that's good.
Or seeded bread,
Yeah, no, that's fine. As I said, if you can, try not to eat later than 6, 7 o'clock.
No, yeah.
Because after 7 o'clock, they say it proves that it's harder to
Level goes
be
high.
higher and it's harder to eat. Basically, what happens because you don't burn it, it stores around here. So it all store. This is why a lot of men, Indian men, they look skinny when they have a big belly, because it's called visceral fat that stores around your organs. So if you can, by 6 o'clock, last meal, you can have a bit of fruit or something, or not so very good.
Here we do other way around. We eat proper dinner in the
Yeah.
evening
Yeah,
or night time. But in India, they do the proper dinner at the daytime,
Yeah.
lunchtime.
that's what. Yeah, we've changed it. Yeah,
People are
working. Yeah, it's hard. Yeah, so if you can, it's a very good idea to change it to lunchtime, your Indian meal.
very tired, then you can
Yeah.
do that. Just-
Yeah. Eat lunchtime, yes, like nothing. And then I think every day you should have 10 nuts, almonds, hazelnut, whatever, 10 nuts at night. You walnut, cashew nuts, just 10 of them in the evening. And that's great as well. That will help your cholesterol, snacking, and fill you up at the same time, yeah? So, any more questions? Anything? Auntie Damnikoi? Puchuche? No? Are you sure? You sure?
છે તો તમારે કઈ એડવાઇસ જોતી હોય તો આપે ને
Yeah. Koi puchuche? Dawa mate? No? Are you sure? Okay, sure. Tamne kai biju?
I'm just thinking about I'm on the border for the
Ha.
what is called
Diabetes.
diabetics. And they give you the
Ha. Medicine. Ha.
medicine.
Ha.
Do I take anything alternate of this, like if it's Indian Ayurvedic?
Yeah, you try Indian Ayurvedic? You can try, as I said, diabetic medication, as Auntie will know, metformin and stuff, it's good, but it's very heavy. And it's
I do try taking now
Yeah.
little bit.
Yeah,
but,
so-
I'm not at the moment, but if the doctor says, take it.
Karela, yeah. 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 Karela too. But I'll be honest, if you're a borderline diabetic, like I feel borderline, I would really be, for a few months, be very strict on everything as much as you can. Because the problem is, once you get to over diabetic level, your record, your records, everything's.
Because you know the pharmacist medication is control you straight away.
Yeah.
But Ayurvedic, this takes time.
Yeah, it does take time.
So you can't like level down your diabetic straight away.
Yeah, of course, it's hard. If you're on the borderline, I always tell my patients, if you're borderline, I say for 3 to 6 months, be very strict on yourself.
Yeah.
Stop everything as much as you can. Because the problem, if you're,
Ayurvedic dawa.
Ayurvedic dawa, and just be very strict on exercise, try and cut all sugar, everything as much as you can out, just for a few months until you get your levels back down again. Because if you're a diabetic, it's hard because you have to put it on your insurance forms, you have to put it on health, travel insurance. Eventually, like if it gets bad, you have to tell the DVLA driving. So it's a very complicated disease, diabetes. So that's why anyone who's on borderline, I always say, for the next 6 months, cut everything as much as you can. Drop everything. It's boring, but eat clean. And once your levels come back to down, then you can slowly introduce the foods back in again. Not too much. Like mug pani. Mug is very good.
Get used to it.
Yeah. Yeah. Chana, yeah. Methi, mug, and all that is good. Kidney beans, yeah. So, as Auntie said, yeah, protein. Try and have it, if you can, try and have your big meal at lunch, and the evening have something very light, soup or something like that. And then if you need to snack, nuts, fruit. But as I said, if you can stop eating by 6 o'clock, you'll notice a very big difference. Because the thing is, they say now, if you try and do intermittent fasting, so if you eat at 6, and then the next day you eat at like 9 o'clock, that's 15 hours you've not eaten. It's very good for your insulin levels and your weight drop. So that's what I try and do. I try and eat at 6 o'clock, and then I don't eat the next day until 10 o'clock or 11 o'clock. So it's 15, 16 hours of nothing, just water. So I'd only do that 2-3 times a week, but it helps fluctuate and keep your weight down. It keeps your insulin levels down as well. So have a try and do that. And as I said, take the vitamin D and you'll be fine. Yeah? Kaviju, any other questions? You happy?
I think they have called me.
Yeah? Yeah, so if you want another session, I'll speak to Rana. We can do another session again, whatever you want to, if you want to talk about something specific. This is just very broad about medication, taking medication, how to be a bit healthier and what you're doing. Of course, Auntie.
The osteoporosis once weekly, that medicine.
Yeah.
What are the side effects for that?
Which one? The hyaluronic acid? So the main side effects is it can cause problem with your teeth and your jaws. So they should say you have a dental check every 6 months. Yeah, and very rarely it can actually cause a fracture. So just be careful of that. But generally, it's okay medication. The very important thing about what you're taking, hyaluronic, is when you're taking it, you've got to do it properly sitting or standing. Yeah. Because if it stays stuck in your esophagus, it can burn your esophagus. Yeah, so you've got to be careful. It can cause esophagitis on here. So that tablet has to be either sitting or standing for half an hour. So it's, yeah, half an hour. But if you're going to do it, you've got to stay sitting or standing. Don't move, nothing. Because if it gets... I would say if you're standing, you can move. But if you're sitting, then just stay sitting for half an hour. So if you take it for... Yeah. But you've got to be very careful because you never want that tablet to be lodged up here because it can affect your...
I just started this month.
Yeah.
So, and I can move about.
Yeah, you can move about, yeah. But just as I said, get your teeth checked every 6 months because it can affect your jaw.
Just last week.
Yeah.
That's why I didn't come.
Yeah. Cavity, yeah. So 6 to 12 months you should check on that medication because it can affect your jaw. But otherwise, you should be fine on it. And the vitamin D you've got as well, calcium or something. Chewable one, yeah. Take that every day. And as for you guys, take vitamin D one a day. More important, lad. More important, yeah. Bada mate, vitamin D. Everyone should take it. Especially if you're Asian, you should take vitamin D because we don't get the nutrition. Yeah. Yeah. Yeah, no sunlight. So it's very important that you take it. So yeah, that's...
They check, they call a test called HB1C.
Yeah, 1C, yeah.
That is average glucose level for over 3 months.
So you can't cheat. So if you've been good for 1 week, they'll know because it comes over 3 months. So if the finger pricking is instant, but that's instant, that's a check if you're feeling high or low. So still slightly high. Yeah, 9 for 1. Blood test. Only doctors can do that at surgery. Left, yeah. But it's got to be done that was over 3 monthly period.
Different and when you take it out.
Yeah, that is just glucose.
On the day, on that point. So whatever you're feeling. So if you're feeling like if you
Only 1 day.
1 day, yeah. So if you're feeling unwell or something or hyper, one time, or if you've had steroids or something, then you check your sugar levels more. But this blood test is the one that you have to get doctors. It's a proper blood test, and it shows you over 3 months. So you can't cheat it.
But I got a question.
Yeah, of course.
HbA1c, there was a time it was a 6 percentage wise.
Yeah.
But now they've increased.
So what we do now is 6 to 6.4 is pre-diabetic. 6.5 and over, you're now classified as a diabetic. Okay, so you need to keep.
There was a time 6 was a border.
Yeah, so they've changed it now. So if you're at 6, as long as you're under 6.5, you're fine. Yeah. You've got to stay under 6.5. 6.5 is a diabetes, and between 6 and 6.4, you're pre-diabetes.
And I said, no, I'll control it. I don't.
Yeah.
And then they checked it after 3 months, and it came down 6.4 or something. So we just good.
So if you take diabetic tablet or something, is it they got a side effect?
So metformin has a lot of diarrhea, stomach cramps. A lot of people can't. All medication will have side effects, but
after long term,
some people can't even take metformin. They have it that bad. So there is loads of different medications you can use. But the thing is, main people have type 2 diabetes. Type 1 is insulin only. Type 2 is tablets. And you can use injectables. They've got new types now, but most Asians will have type 2.
Because my husband started
Trulicity, the injectable, weekly injection. So they're new type now.
And Fosi got tablets, which is, so he lost about 1.5.
Because that tablet helps with weight loss as well. So these injections help with weight loss for diabetics. Yeah. So Auntie, you need to see your pharmacist, your doctor. Ring your doctor and say, can I speak to the pharmacist and have an appointment? Because if your metformin's not working, then they might give you something like injection or Dapag or Fujitsu, which is another tablet which helps your weight loss and control the diabetes. No. So these injectables, they work on certain receptors in your body. They're not insulin, but they help with weight loss and diabetic control. Yeah.
My mother used to take the injection.
Yeah. So you have the insulin. This is a new one. Yeah, once a week. So you get like Victoza. There's quite a few Trulicity. There's different types out. But people who are really struggling with diabetes and are overweight, they normally give these injections because it helps with the weight loss. So Tamara, it's good to speak to your diabetic nurse in your practice if your diabetes is not under control.
Side effect kind of?
Everything has side effects like vomiting, sickness, constipation, sickness, diarrhea. But some people get used to it and it's fine. Yeah.
Side effect માં પછી એની kidney fail થવા માંડી.
It's very rare. It depends if that's probably linked to the diabetes though. Because the diabetes is poorly controlled, so it's causing kidney failure. It won't be the medication that's caused it. If your diabetes is poor control over years, then it starts causing kidney failure. So that's why if you're diabetic or on the borderline, you have to be very strict. Yeah, especially diabetes. Diabetes is very complicated. It affects a lot of other problems. It doesn't just affect the toe. It doesn't just cause sugar. Yeah, it's not blood pressure can cause problems, but diabetes, cholesterol, blood pressure, eyes, feet, kidneys. It can affect everything. So just be careful on your diabetes, especially if you're diabetic.
Was very fit person. He
Yeah.
ran 7 marathon and all that. And his the heart rate was 45,
Yeah.
50, something
Okay.
like that. But recently he started getting this spell. I said, go and see your doctor
Yeah.
because I can't do anything.
Yeah.
I need to see your GP.
GP.
So he done that and he sent me to Leicester Journal
Yeah.
for a heart monitor. And they asked, have you had the ECG? He said, no. When they did the ECG,
Yeah.
it shows like a saw-like pattern. So
Okay.
it says you got an atrial flutter.
Atrial flutter. Yeah.
And then they said that is within a limit, so you don't have to go to
Yeah.
left. But then again, he started having it.
Okay.
So I said, go and see your GP
Yeah.
again. So he went, and his pulse rate was dropping down. So he got admitted. First, they thought it was a mini stroke.
Okay.
So I took him to
Yeah.
Leicester Royal, and they did MRI scan.
No, what checks artery scan. Yeah.
Everything was normal. And they did ECG 10 times.
Okay. Still.
What's going on?
Yeah.
Our consultant said, I want to do it myself. So he did it, and he said, you are prime candidate for plasmic.
Okay. So yeah.
And he was referred to Lentin Hospital.
Okay.
And within 3 or 4 days, they put the best.
Because he had bradycardia, didn't he? Slow heart rate. Okay. Went down.
You know,
Yeah, it happens. Yeah.
person.
Yeah. Sometimes it's genetics, family history. Sometimes things happen. Some people are very fit, and unfortunately, so yeah. I said this. I mean, diabetes could have been a little link in there somewhere. So you don't. All the diseases are linked somehow. So you just got to make sure you've got all under control.
And as we grow, something will come.
Yeah, something will come. Yeah, it's very rare that you see anybody. Yeah.
Any reason?
No. Yeah. We have this. It's unfortunately it's just we live it. Yeah. Especially with our Asian community, it's very different.
આપણે લોકો sweet. નર્સ હતી ને, no gulab jamuns,
Yeah.
no jalebis.
Yeah, that's it. They know. They all know what it. Yeah, they know. Sugar sweet. So it's been good to talk to you all.
Yeah, thank you.
Yeah, no problem. As I said, I'll speak to Ron if you need another session or if you want to. Any questions, you can give me my contact and then you can speak to me about it and stuff.
Just give you.
Yeah, and I'll give you your contact details and then I'll give it to him to give to you guys. And if you want any questions, you can email me and stuff and I can answer you, I'll give you questions back. Yeah, is that all right? Yeah, so lovely to meet you all. Take care, everyone.